welcome everyone. Thanks for joining us tonight. This is Healthcare for All's second Wednesday speaker series. And this February, we are celebrating two iconic Black nurses in our community who have made some great contributions. So welcome, welcome, welcome. So my name is Ronnie Shure. I volunteer as president of the board of directors of Healthcare for All Washington. Tonight we'll be celebrating Black nurses in our community and the contribution that they are making. We have two nurses. We'll talk about and we'll introduce them and give their wonderful histories, and they will also share with other mentors, other leaders in the community. So it should be an interesting conversation tonight with Frankie Manning and Vanetta Molson-Turner. So welcome, welcome, welcome. Right. Just like me, you too can volunteer for Healthcare for All Washington. So please consider working with us on our policy committee, our communications committee, or our fundraising outreach committee. In the chat, we're going to be posting a link to our website, and there you can find, of course, the donate button to make a donation. You can do that anytime during the meeting. But our website also has a button called Get Involved, and that's a place where you can volunteer and help us. Yet we need people that are helping with ideas and other plans. So please go to our website, make a donation if you're able. Every donation you make helps us move a step closer to universal health care, to providing coverage for everyone in the state. We have set a goal to raise $250 during our program tonight, and you can go to the chat at any time during the presentation. We will have the link up there for our website where you can do that. In addition, use the chat section to track any questions that you have. We'll be using it to track those questions. So go into the chat, ask any questions that you have, and then we'll have a Q&A session after we finish our presentation. So please go into that section and or into the chat and enter any questions that you might have. Also note that you can click on the closed caption icon at the on your screen. If you go down to the bottom of your Zoom computer screen, you'll see a button that says closed captioning. It'll have that icon. I think, if your screen is too small, you'll have a button, but you can find it if you go to the more buttons, and there's a place called captions and a little CC symbol, and so you can enter your questions, or you can look at closed captionings for that. I am participating in this Zoom meeting today from the lands of the Coast Salish people. We acknowledge all of the ancestral homelands and traditional territories of indigenous peoples who have been here since time immemorial. And our effort to achieve health care for all includes all the peoples of this land. And tonight, we're going to be introducing I'd like to start by introducing the two nurses who will be sharing in our conversation tonight. So Ron, if you want to highlight Vanetta and Frankie. Frankie served in the U.S. Army and had an integral part in the Department of Veterans Affairs. So she has actually seen a true single-payer system that our government has set up. Universal health care, may have an option like single payer at some point in the future, or as one of the options for covering everybody. So Frankie has seen that work, and many people in our are served by the Veterans Administration, by Indian Health Service, and have seen one of the ways that we can achieve universal health care. We are working on a number of different options to make it happen in our state and to make it happen nationally. So Frankie has also been on professional boards such as the King County Board of Health and even the Washington State Board of Health. She's had a valuable role in equity programs. There is a combined healthcare centers in our city that have a community advisory council that Frankie has been a part of. She's worked with nursing programs, counseling and mentoring young people of color. There are several organizations that have been carrying on this work, and Frankie has been one of the more iconic members. There's a Washington Center for Nursing, but also the Mary Mahoney Professional Nurses Association. And we will add that website into our chat later on in the meeting as well. I'll do that. So in addition to her work in the U.S. Army and on these different boards, Frankie, thank you for your work with reversing racism, with having a positive impact on different parts of our community. Just to point out the two last things, she was awarded the Dr. C. June Strickland Distinguished Diversity and Transcultural Nursing Advocate Award a few years back, and was named as one of the 100 most influential nurses with ties to the University of Washington, and has demonstrated her commitment to improving the lives of others. And let me introduce Vanetta Molson-Turner. Vanetta has been a nurse for over 3 decades. She was inspired by her participation in the Seattle Black Panther Party. We know, and I've heard Vanetta talk about this time and time again, that the Black Panthers were about community services and have been influential in starting clinics or kicking off the people or pumping up the people that are starting clinics in our community and providing food and other things. Vanetta will talk share a couple of examples of that. She's been a part of progressive groups. We both served on the executive board of Puget Sound Advocates for Retirement Action. And although Vanetta remains humble, she's been involved in starting national groups like the Radical Women of the United States. So I'd like to welcome you both, and let's ask you to unmute, and I think you might have to push a button, Vanetta, to join us. There you go. Welcome, welcome, welcome. So we have established or come up with 3 questions just to spur our conversation. So I've talked a little bit about the history that you all brought to our community, are brought to your careers, but let's step back and talk about and maybe Frankie, you could start. What was your inspiration for becoming a nurse?
Well, I've been a nurse for more than 60 years. And so you probably don't want me to get started talking about how I got started because we'll be here all night. But I'll try to summarize it. When you deal with old people, as you know, you get them started, they tend to not be able to shut down very easily. But I grew up in a very small town in Texas. And in my town, in the days when I was younger, we had no hospitals. We didn't have clinics. we only had our local doctors who would come and visit, and my aunt, who was a midwife, and who delivered all of the babies in town. And I grew up watching my Aunt Sarah and my two grandmothers, both, Aunt Sarah was much younger than my two grandmothers, but everybody in town, all of the white people in town, called my Aunt Sarah Miss Sarah Penny. And my two grandmothers, they called them by their first names. And I thought that was very disrespectful, because we grew in the time that I was coming up, you grew up to call everybody Mr. or Mrs., and you were very respectful. But anyway, as I grew older, what I learned was the reason they called Aunt Sarah Miss Sarah Penny, because she was seen as a professional, and my grandmothers were not. And so, uh, but as and the other part of that, I also learned what it meant for Aunt Sarah to come to a house and how much she supported families. So I grew up understanding that, here's my Aunt Sarah, who was doing, in those days, we only called the midwives, and then my school nurse. Those were the nurses that I saw in my life. And so I decided I wanted to be a nurse or mortician or a physician. I had happened to grow up in a large family, so um, the closest place for me to become a mortician in those days, where blacks could go, was in Indiana, and for me to be a doctor would be North Carolina. So I had to make a choice, because there were all of us who were going to be in school there. My parents would have had four people in college at the time when I was going to school. So that wasn't economically feasible. But what I finally decided on becoming a nurse, I learned that caring for people was such a valuable resource. I'd seen what my aunt did as she cared for families. And so I valued that, and decided that nursing was my calling and where I wanted to be. And I've never regretted it. It's been a wonderful profession. I've been able to care for people at their worst and at their best. And I've seen the babies come into the world, and I've also seen the death of parents. And but what I learned through all of that is that, when people are ill or when they have needs, that when you can provide them care and services, it is just beyond anything else that you can do. And so I have I've cared for many souls, and I can tell you, uh, I've gained more than I've given. I always believe, but it's been a great profession. I encourage people to go into nursing, because it is a great. It's not a job; it is a profession, and I can tell you that you won't regret it as you go. So that's kind of how I got started nursing. It's been a long track along the way to where I am, but those were the things that got me going. And of course, when I was pursuing all of this, as you can hear, I grew up in this black and white world, and then and even when I was going to school, there were things that you couldn't go to certain schools, but you could go to others. And but I never felt neglected from that, because my parents taught us that education was the most important thing. And so, um, I've been blessed, and nursing has been good to me. So I'll let
And,
Vanetta talk.
and those kind of messages about just your family history,
Yeah.
your geography, about
Yeah,
where you're from, and the lessons that you picked up from your community are lessons that we can pass on to the next generation, to younger people. And I know you've been an inspiration to many young nurses and participated in that and in that nursing in the school process or training process. So it's great to have you in our community now. I'm glad you made it to Seattle.
yeah.
So Vanetta, I kind of stole your the answer to that question by talking about your role with the Seattle Black Panthers, but perhaps you, or I know, you could really explain that much better than I did and give a fuller picture of your inspiration to go into nursing.
Mhm. Well, I love nursing, and I grew up going to Harborview. It was called King County Hospital. I don't think so. It wasn't Harborview. Forget the name of that hospital, but boy, I didn't like it because we would sit in that hospital for so long with my mom and my sisters and my brother, and getting our checkups and getting uh, checked. And the nurse would come and put the thermometer under my tongue and come back and say, "You have to keep it in there. You're playing with it." And I wasn't playing with it. Okay, so I kept it in my mouth again, and she came back again like 5 minutes later and says, "You can't be that low. You you're not doing it right. You're not doing what you're supposed to do." So, that gave me a bad taste of of a white uh, nurse at least. But uh, I learned that there were many gentle nurses, black and white, and who can care for people civilly. And then, some other things changed. And I went to Cleveland High School, and before I had to go, I mean, before I um, graduated, I was sent to with the Urban League to New York City to take a summer program to give care and some kind of uh, uh, I'm trying to help people in these communities in the South and in other places. But they took 50 people or kids from different high schools and different schools across the country and sent them to like 4 and 5 children or young people to different cities. And I was in with a group of 4 or 5. I can't remember that part, but the it was really impoverished. It was awful to me. And I was 16 at the time, and the other people were a little younger, and a couple of were a little older, but I didn't have an idea. I didn't have any idea of what to do. So I came home that summer very sad And when I got back to school, before I graduated, I started working with the Panthers for the breakfast programs, because I was in Holly Park and they had a neighborhood house that had a breakfast program. And that's when I got with the Panthers too. And when I got out of high school, and then I dropped out of college and I wanted to be a Panther and a revolutionary to turn things upside down or upright. And then when that petered out, I came back to Seattle, and I went downtown down into California for campaigns for Bobby Seale and Elaine Brown. And then I came back home and got back in school and got into a nursing program. And after I graduated and started with Swedish Hospital, and I got married, I had a son, and became a nurse. And boy, was I so happy. I think that was the best thing I could ever do. And just be caring for people like that, you know. But there were things that I didn't like, but I stayed 36 years. 35.
And there's a great video that the Seattle Civil Rights and Labor History Project has done, where they followed you around town to a couple of those locations. We'll put the link for that video in the website or in our chat later on in the meeting. And you've told me about how things have resonated from those early days with the Black Panthers, of seeing community clinics that were just starting and that they are still going on and expanding services. And the fact that you weren't just looking at the one value of changing the world, you were feeding people, you were creating those clinics. The Black Panthers did a lot more than we had really thought. And it's really exciting to hear both of you all describing your family history and how that has helped form you to become the caring people that you are. And nurses certainly do have that tradition, that role. And I guess once you're a nurse and you're caring for people, you're always doing that. I know you each have talked about helping out others, even to this very day. So it's a pleasure to be seeing that. I think one of the young nurses of color who was asked to comment on your roles, on each of your roles, gave us this Martin Luther King statement, which was, not everybody can be famous, but everybody can be great, because greatness is determined by service. And the nurse's role is often underestimated. The nurse's role in our healthcare system is often taken for granted. So it's really powerful to hear those stories that have led you to this level. So, you know, I have more questions to ask, but already I just want to thank you for both of you for taking that turn and using that inspiration. And you have both talked about role models and people that have come before you. I remember one incident, Vanetta, of you and I participating in a PASARA, in a Puget Sound Advocates for Retirement Action program on one Martin Luther King Day. And we were all had these specific roles of talking about this action or that action. And you started talking about Harriet Tubman, and it really changed the nature of what we were trying to communicate, and gave people that reality that you had connections with the people that came before you, so to say. And it really rang strongly in that room. It was a powerful feeling to be there. So thanks for that. And I think, Frankie, I would love it if you could share a few words about Mary Mahoney, and the organization that you all have, a number of Black nurses have built in the Seattle area. And can you share that with us for a couple of minutes?
Sure, I
Frankie?
will. It's hard to condense it in a couple of minutes. We're having our 75th anniversary this year. And for those of you who may not know, Mary Mahoney was the first Black nurse who graduated from school in America. And in the 40s and the late 30s, when she became a nurse, you could not join the American Nurses Association as a Black nurse. And so she formulated and started Mary Mahoney nurses, professional nurses around the country. So in every state, there was a Mary Mahoney Professional Nurses Organization. And in the late 50s, the ANA said, okay, you guys, we'd like to have you in our organization and you can participate. And so many of the Mary Mahoney organizations went away, except the one in Seattle, there's one in Detroit and one in Mississippi. And we're having our 75th anniversary this year. The one in Detroit is having their 100th anniversary. And what's powerful about the one in Seattle, and if you go to our website, you can see this book that I'm holding up for you to see. But one of our members wrote the story of the Seattle Mary Mahoney nurses. It's called African American Registered Nurses in Seattle, the Struggle for Opportunity and Success. Great. Ronnie is holding it up. Great. When you go to our website, you can see it and you can purchase it if you like. What's powerful about the beginning of this group here in Seattle, it was started with 13 nurses. Most of those nurses came from the South. And when they came to Seattle, they could not get a job as a registered nurse. And the only place that would hire them was Harborview. None of the other hospitals in town would hire Black nurses. But even at Harborview, they hired them in the kitchen and in the laboratory and other places. And Miss Baker began to see this cluster of women, and she started talking to them and found that they were all registered nurses. So she began to have them come together and meet at her house, and that's where she learned that all of them were registered nurses, and she saw that they became employed as nurses in the hospital. And what they found when they first started this organization, it was called the Mary Mahoney Club. And really what they wanted to do, they started out in a socialization process. But over time, one of the things they wanted to do is to go back to school, get their degree and other things. And many of you may not know that the University of Washington, although it had a nursing program, the dean at that time refused to allow Black nurses to go to the University of Washington, even though it was a state-run school. And so it wasn't until 1951 that we had our first graduate from the University of Washington. And what's powerful about that, at least to me, the school, one of our first scholarship recipients graduated in 1951. And part of what we did, Ms. Baker said that nursing was a service, like being a minister, that you were called to be a nurse. And so part of their mission was to help other nurses get into nursing, and also to provide community services. Because even then, many places in the city were segregated for Black people for service. And so they provided lots of health education in the community, and wanted to help people to go, Black nurses to go to school. So that the families were all involved in this organization early on too. And that was, they did bake sales and car washes and a variety of things to raise money for the nurses to be able to go to school. And that was really something that has stayed with our organization. We continue to raise money and give scholarship. We also provide community services. And part of what we do with our students that we work with is we mentor them also. And that's so that they can graduate with school and be successful, but also in their professional career. So they learn the ups and downs of being a nurse. So we take them as students with us when we're going out for community health screenings or other kinds of things in the community. So it's a labor of love, and sometimes a real challenge, because we are generational. In fact, we lost our last founder 4 years ago. She was 99 years old. So this organization has been able to see the strength of the people through generations. And so that's a really great contribution, because all of us mature people, as I see on here, that many of us are fairly mature. So the younger people don't always value what we bring to the table, but what is important, that they do get to see us operating in service and in the community. They also learn that you can do things without a lot of equipment. So it's a great opportunity to work with students. As I said, we're having our 75th anniversary this year, and part of that's one of our big fundraisers each year, is to be able to give scholarships to our students. And we like to engage their families so their children can see what their parents are doing. And when we first started out in scholarships, there were $50 scholarships and 100. So, but in those days, that was a lot of money. But, I keep saying to people today, when we give somebody $3,000 or $4,000, it doesn't seem like much. And it doesn't seem like much when you think the cost of books sometimes a book can cost $500, a medical book. But anyway, it's a great way to nurture young people and to help them, and to see that some of the things that they see and experience may be challenging, but they can live through it. They won't die because somebody speaks badly of them today, or say something sluggish, a slur about Black people or other people, but they can educate them in terms of the right way of looking at people as we are human beings. So that's really a high sketch of who we are as Mary Mahoney, and then who our organization is. And every year we give an Ann Foy Baker Award out, and that's for somebody who really reflects our value of community service, and we do it not just to healthcare people, but to people in the community as well. So it's Ms. Baker did a wonderful job when she started this organization. And even though we have a national Black nurses organization, our group decided that we would remain Mary Mahoney Professional Organization of Seattle because of our history. And so I think those are the important things.
And you you make it sound really easy, but it is a battle, and it's not just recognizing, what some person did to you as a child or is doing now. It's really coming up with policies to fight racism, anti-racism groups that each of you have been a part of. So your voices are so important to share that history, but it's so proud. We're so proud to see you stepping up there and still leading those organizations uh, and I've like focused on you a little bit, Frankie, but if we could start with one last question, which is really more about a triumph that you had in your career that you could share with us, that because each of these little statements you're saying about a nurse's caring has a much bigger impact than just that one word. You have really expanded the meaning from your careers. I did put the Mary Mahoney, a link for the Mary Mahoney site in our chat. So please do go there, look at the names of people that Frankie and Vanetta, the shoulders that Frankie and Vanetta are standing on. It's a very powerful history. And uh, and who thought, that familiar names like Harriet Tubman people were actually nurses in different levels and in small communities. Like Frankie, you talked about your family. So it's so powerful for us to start recognize some of those names, but it's growing, and it's great for us to pay attention to that. So I kind of went on for a second there to give you, Vanetta, a chance to come up with, maybe one last thing to share about, something that you witnessed during your career.
Who are you asking? Did you go out?
Nope, you're there.
Me?
Yep.
Oh,
And I certainly have prompted you or, have witnessed, an interaction with you at that one rally a few years ago, and your role in that civil rights film that was made, or the interview with you. I think we can find out some details there. You've both shared a lot about your inspiration and your family history, as well as these other icons that came before you. Is there anything you'd like to share with us about a triumph or an event that really brings you joy and satisfaction to look back on?
Well, as I said, when you practice that long, you have lots of joys and you have lots of challenges. But one of the things that I feel fortunate to have grown up in a small town and lived in lots of cities that throughout the rest of my life and across the world. But what I learned was that many people in practice had never understood what it's like to live in a small town. So, I worked for the VA for more than 42 years. And one of the things that I always found fascinating was how we expected these little old men to get up at 5 o'clock in the morning, come all the way from Port Angeles or Port Townsend or someplace to be here for a 9 o'clock appointment. And I just happened to one day have overheard this conversation where somebody wasn't going to see this elderly man who had come in for an appointment, but he was supposed to go for lab work, and he was went and got his lab work, because most veterans are they follow orders very well. So he got his fireworks. By the time he finished and got to his appointment, he was late. So they weren't going to see him. Now he was there in time for his 8:30 appointment. If you have traveled through the island, you know how long that takes. And I was so upset. I was somebody sent him to my office, and I ended up having to ask 3 different people to see him before he left that day so that he could be seen and get back home for his ferry. And I was bothered by that because the people who I was working with, I also valued them and I knew that they cared about people. But what I clearly in conversation with them understood, they had no clue about what was happening with this person who they had scheduled an appointment with to come here in the morning. So I met with some of my staff and I said, we have to do something about this. So we decided that we would have outreach clinics and we would go out in the places where people came from, where populations were. And we did. We started mobile outreach clinics, and we went to Forks and Port Angeles and Port Townsend and Bremerton. We went all over the state, all the way east to Vanetta and south to Aberdeen. What was powerful about this was some of the people who was giving me a hard time about seeing this little man, they decided they would go on a clinic with me. Now, we met on Saturday mornings after having worked all week. And to me, what was great about that, I never had to assign anybody to work. They all came to that clinic voluntarily, and nobody ever called in for that clinic. And we were in hangars out in Port Angeles. We were in reserve centers. We were in churches. We were in places that people wouldn't provide healthcare usually. And it was wonderful to see these young people providing care in the community. One of the proudest things I had was I had people who worked with me who was my colleagues or higher who said, Frankie, if you do this, nobody's going to come. And sure enough, everybody came. And we served sometimes on a Saturday 500 people. And it was a blessing. And it was wonderful. And not only that, but the younger nurses and psychologists and audiologists and lab people, they all learned what it was like for these people to be coming all the way to Seattle from someplace for a 9 o'clock appointment. And so we began to adjust our appointments, but more importantly, we were able to carry services to the community. And what I'm most proud of is that we started in Seattle at that time. We didn't have but one clinic, and that would have been the American Lake Hospital where we had clinics. But we started clinics. So we ended up getting a clinic in Port Angeles and Bremerton and in Bellingham. And so what was great about that, when we went out into the community, the veterans found us places that we could provide services, didn't cost us 1 penny. And so I always tell people that when you work in communities and you're providing a service, that people will work with you. And my director was always surprised that we didn't have to pay for rentals or any of those kinds of things. But that's one of the things I'm most challenged, but I'm making it sound fairly easy. That was a real challenge because the people above me, some of them didn't want us to do it. And then we had to network in the community to be able to find people that would help support us. But the veterans helped us make that work. I'm most proud of that. And there are lots of other things in life.
Well, and those are very valuable lessons as we try to improve our current system, our current marketplace for healthcare and change it into a true healthcare system. It's
Yeah.
going to take people in specific communities to really step up. And so, Vanetta, before I give you a chance to add your final comment, is that remind people that we are putting the website in our chat, and we would love to have your questions or comments for Frankie and Vanetta. I see a lot of nurses in this group watching us to participating tonight. So please feel free to jump in and add a question in the chat. So after we get a final comment from Vanetta for this panel, we're going to bring in Peter Lucas for a brief moment, and then we'll come back with Vanetta and Frankie to answer those questions. So go into the chat, add questions that you may have or comments. We'd love to hear that. So Vanetta, you're up.
Okay, one of my triumphs. I mean, wouldn't call it that, but the Black Panther Party is the Seattle chapter that I was one of. We worked with Carolyn Downs Clinic. We got it up. I mean, we got helped with the free clinics, and Carolyn Downs Family Center moved in the 70s at the Odessa Brown place, the one on 22nd and Yesler. And the Carolyn Downs Clinic is still there. It is still in its the Panthers legacy for sure.
All right. So don't leave, but Vanetta and Frankie, Ron is going to take you off of camera off of spotlight for a minute and bring Peter Lucas up. Peter is a member of our board, and he's going to share a few words. Dr. Lucas.
Hello, everybody. And I want to thank you, Vanetta and Frankie, for those inspiring accounts of your lives and careers. And over my many years, I've worked with many wonderful nurses and have the utmost respect for what you do. But it's my job tonight to make the pitch. And as many of you know, over the past few years, our organization, Healthcare for All Washington, has chalked up many legislative victories in Olympia. We're very active in the 2023 legislative session and now again in the 2024 session. And many of the progressive bills that we have supported and lobbied for were passed or in process right now. And if you want to get an update on what we're up to legislatively, click on the legislative tab on our website. Now, to maintain our momentum, it is vitally important that we meet with our legislators, grow our membership, educate the public, and mobilize our supporters to spread the word about universal health care to their families, friends, and most importantly, those in power in Olympia. And we can achieve those goals through the hard work of our lobbyist, Lonnie Johns Brown. We also employ a communications specialist and are active on social media, conduct monthly webinars, such as tonight's excellent presentation, and we have meetings with civic groups and host other events. Financial support of our staff, including Lonnie, as well as our other activities and obligations, all require funds, which is why we are asking you to donate tonight and every month at these webinars. And as Ronnie said earlier, our goal tonight is $250. So please go to the links in the chat or our website and click on the donate button. You can make a one-time donation, but we would especially appreciate it if you could make monthly recurring donations, as those can provide support throughout the year. So please donate so we can spread the word and bring about universal, publicly financed healthcare in Washington. And we are making real progress, but there's still much more to be done with your help. Thank you so much.
Thank you, Peter. Thank you very much. And so, Marcia, I just see two questions. So why don't I go ahead and just ask those questions? If Ron, if you can highlight Vanetta and Frankie one more time. The first question is really for you, Vanetta. David asked that in the 36 years, I just lost it. What did I do here? Don't go away. I'll get right back here. In the 36 years that you worked at Swedish, what changes were nurses able to make in giving a voice to how much to a role that they could play in the hospital, how the hospital was run, and how much respect the nurses were given? What changes did you see over your career at Swedish?
A larger union, nurses union. Sorry.
So labor gave you a voice. Is that what you're saying? And
the floors and getting different pay, different hours. It was good. We worked hard, and I didn't mention the union when I was talking about my career.
Thank you. And so, Frankie, another question is about what advice do you give to young people of color who are thinking about becoming nurses? You've said several things during your conversation tonight. Is there a couple of key issues that you would share?
Oh, yes. I always encourage them to if they have an interest I try to share with them, if they've not been around nurses, to share with them what nursing is all about. Because some people go in and thinking it's a glamour job, and it can be challenging. So I want to share with them those things, but it's also so rewarding. So I try to share with them both sides of that. The other side of that is I encourage them to go to school to get their degree. When I went to school, when I started out, I was a diploma graduate first. In those days, 3-year programs in hospitals. And then I got my degree much later and went on for my master's. So I try to tell them about getting as much formal education as they possibly can. And I also share with them the many roles that nurses have, because it's not just providing direct care at the bedside. There, you have nurses who are educators, you have nurses who are researchers, you have nurses who work in the community. You have all of these different ways that you can practice nursing. So I try to share that with them so that they can see that there are real options. And truly, I try to tell them about the policy part of nursing, which sometimes we complain about what people are doing to us, but we don't understand that we're the people who can make the changes. And so I encourage them to look at options for helping create policies and changes within their institution or wherever they're practicing, which is really important to do.
Well, thank you. Thank both of you for joining us tonight, for taking your time. And we talked several times before. I told you this was not going to be a major presentation taking hours of work, but we spent a lot of time together, and I've really enjoyed the time that we've had together. So thank you, Frankie. Thank you,
Thank you.
Vanetta, for your contributions to us to raising our awareness tonight, but also for the work you've done for our community and the images that you've had. And it takes a lot of strength to share these stories. So thank you. I also want to thank the volunteers who made tonight's event happen. Ron Lovell and Rich Legoo and Sydney Jones, sorry, and the communications people that spread this message, helping promote these events. We do have put the website for the Mary Mahoney organization in our chat. We've put our website. We'd love to have you volunteer with us, even if it's for small things. We really could use your input. And we also want to invite you to look at Vanetta's interview with the Seattle Civil Rights and Labor History Project. And Karen mentioned that there's a history on the PSARA website, an interview that Frankie has given to Angie to put onto the PSARA website. So look at Karen's reference for PSARA, PSARA.org, and look for Frankie's personal history or oral history there. So thank you both for your contributions to the organization. Thank each of our volunteers that helped make it tonight. Most of all, I want to thank each of you for joining us, for recognizing the impact that Frankie and Vanetta and other Black nurses have had on our community. So thank you to all of us to help us celebrate this event. And join us next month on the second Wednesday of March, the 13th of March. That's not the Ides of March, is it? That's the 15th of March. But on the 13th of March, we're going to be addressing how to answer some of the behavioral health problems in our lack of care in our community, and some of the solutions that we have all been working on. And so join us on the second Wednesday in March, March 13th. And again, thank you all very much.